I have cut open thousands of people. I've been inside hearts, lungs, abdomens, brain. You think you know what kills people? You're wrong. And I can prove that. Stay with me because what I saw behind the drapes in the hospital will make you change one thing. I'm Dr. Uttam Shiralkar, 65 years old, 40 odd years in surgery. Today, I'm not here to talk about surgery or anatomy. I'm here to tell you what actually finishes lives and why the scary headline or the social media post you read recently might be lying to you. In the next 10 minutes, I'm going to tell you the top 5 killers I've seen, and the number 3 will surprise you. But then, I will tell you something simple you can start to cut your risk. Let's start with a common mistake. When someone says, I don't smoke, I exercise, I'm healthy, most people think they are safe. But medicine doesn't care how loud your intentions are. It cares about what you have actually done to your body. Tell me, what do you think is the single most common immediate cause of death I have seen in the hospital? Heart attack? Stroke? Infection? Surprise. Many deaths are multi-system or multi-organ failures started by something small and ignored. But then, small things we ignore are often the one that brings down the whole house. Number 1, chronic inflammation. Not the dramatic type of inflammation that sends you to hospital emergency. On the contrary, it is the quiet, daily, microscopic fire. It's behind heart diseases, some type of cancers, strokes, and even complications after minor injuries. I remember a 55-year-old patient who felt fine but had widespread atherosclerosis that was discovered during routine surgery. By the way, atherosclerosis is the condition in which the blood vessels get narrowed. If you are wondering, why does it matter? It matters because inflammation spreads quietly but sometimes quickly. Even the investigations like blood tests sometimes miss the story. It makes the joints hurt, your energy dips, but you ignore. That shrug will cost you. But then, here is a twist. You don't need a miracle drug to slow it. Just diet, sleep, stress reduction, small shift. We'll come back to that later. Wait until you hear number 3. It will change how you think about harmless decisions. But before that, number 2, people delay. Delay because of fear, because they're busy, because they hope it will go away. I have operated on people who told me they had felt symptoms for months. But by the time they came in, it was late. Here is a question. How long have you put off that or pain, that lump, that breathlessness? But there is another side of delay, which is misdirected speed, rushing into unnecessary surgery or treatment because of pain or profit. We'll talk about that in another video. Today, it is about timely, honest care that saves life. Now, killer 3, over-investigation and over-treatment. This is the one people won't expect. More medicine can harm. We can test until we find something abnormal and then treat the number rather than the person. I have seen procedures done that didn't improve patients' life and in some cases shortened it. So ask, is every test necessary? Is every operation likely to help? Questioning your doctor is not rude. It is necessary. But then, Here is a paradox. The same system that overtreats also denies care who need it most. That imbalance kills. Now, killer number 4, acute infection in the vulnerable. You know, acute infections used to be number one killer centuries ago. They are less flashy now, but when they meet a weakened system, the elderly, the chronically ill, they still finish the job. I have seen minor pneumonia causing multiple organ failures. Prevention here is both public and personal. Vaccination, hygiene, addressing chronic diseases. And now, number 5, lifestyle accelerated diseases, diabetes, obesity related complications, liver disease. They don't come out of nowhere. They are the slow work of repeated choices over years. Here is a question. Which small habit would you change if you knew it would add 10 years to your life? Hold the answer. I will give you one habit that trumps them all in the conclusion. So, what's the takeaways? The first one is inflammation. Second is denial or delay. Third one is overreach. Fourth one, infection in the vulnerable. And the fifth one is lifestyle diseases. The single thing I would tell my younger self, start paying attention. Precisely, daily, not panic, not obsession, consistent, honest care.